Hi everybody, it's Kane again, healthcare organizer at Citizen Action of Wisconsin, and I want to talk a little bit about, again, the Affordable Care Act, what's in place right now and what's in place down the road. So this video is going to be a lot more of what's in place right now, things that you already have now, protections that you have, or opportunities available for us. So really broad strokes, let me say what's now and what's later, and then the remainder of this video will be about what's taking place right now. So in really broad strokes, some of the protections that you have right now under the Affordable Care Act are, it outlaws some of the worst health insurance abuses, especially those for children, but I'll get into those in a second. And it also requires more accountability from insurance companies. That's the really broad stroke what's right now under the ACA. Now, later down the line, under the Affordable Care Act, it'll guarantee next year that every American has a place to go to purchase quality, affordable coverage. And on top of that, it will permanently outlaw health insurance industry discrimination, like pre-existing condition discrimination. So the last one, my favorite one, is it requires members of Congress to be able to purchase plans that are offered to you and me. Anything they can get, we can get. Now, stage one, some of the early reforms, some of the early protections that you have, the Affordable Care Act requires insurance companies and governments to be responsible for things like preventive care coverage with no copays and no deductibles. This is a huge point in healthcare. This is a huge transition in how Americans receive healthcare. Because before, it was we would go get access to healthcare if we were so sick we needed care. But now, we're making sure that you have access to healthcare now to prevent future worse illnesses. The majority of healthcare costs are by a small percentage of very sick individuals. So if we want to bring down healthcare costs, let's make sure people don't get that very sick. And so really the name of the game is this. If you want to be healthy, go to your healthcare provider. Because right now, there are no copays, no deductibles, no out-of-pocket costs for preventive services like colonoscopies, doctor's visits, flu shots, mammograms, pregnancy screenings, depression screenings, a whole range of opportunities. And so you'll be able to take advantage of that right now. Another benefit is young adults can stay on their parents' policy until the age of 26. Now, part of that is because young adults are jokingly referred to as young invincibles because they feel that they don't necessarily need insurance. We hear a lot of that, but that's only part of the equation. The other part is going into entry-level jobs nowadays, they don't provide the same level of benefits that they did 10, 20, 30 years ago. And so a lot of people just entering the job market may not necessarily even be offered health care. And so right now, there are 6 million young adults between 18 and 26 who are back on their parents' policy, who have that security of knowing that they can go forth and make the economic decisions they want to make without fear of accessing health care. And they can transition to the jobs and the career decisions that they want to make and still have that level of care. And I certainly know it's made a lot of families a lot more secure in this knowledge. Another one I want to mention is preventive care without cost sharing for seniors on Medicare. The reason I wanted to mention this separately than the other one is that for people on Medicare, you've actually had this benefit a full year longer than everybody else. In fact, in 2012 alone, 74% of all seniors on Medicare actually got a free preventive screening or wellness exam or some other preventive care treatment without cost sharing thanks to the healthcare law. So that was just about 3/4 of the entire state. The other part I want to mention is there are a number of healthcare freedoms and violations that have been outlawed by the Affordable Care Act, violations to healthcare freedom. And some of those are that pre-existing condition discrimination for kids is outlawed right now, meaning that if you are a child with pre-existing condition like autism or cancer or diabetes, your insurance company cannot charge you more. They cannot deny you. They cannot drop you. They cannot in any other way discriminate against you because of your condition. And let's face it, if you have one of these conditions as a child, this is probably a genetic pre-existing condition and in no way your fault. Now that's right now. We have these protections for children right now. And next year, on January 1st, these protections are for all adults. Another protection that's in place right now is the end of lifetime limits. You may not have heard this term before, but it's actually a very big deal. Over 2 million Wisconsinites had this on their policy. But a lifetime limit is basically a maximum dollar amount that your policy will pay out over your lifetime. And it's something like $1 million, maybe $2 million, maybe $750,000, which seems like a lot of money, but not in healthcare terms, it's not. And so here's the thing. When you get to this lifetime limit, when, say, you have cancer and you rack up a lot of costs, when you approach that and you hit it, you are actually no longer covered by your insurance policy, and chances are you now have a pre-existing condition. So lifetime limits were actually the leading cause of medical bankruptcy in this country. And overall, medical bankruptcy is the leading cause of bankruptcy in America. And so just by addressing this issue, just by ending lifetime limits, we're going a long way to ending bankruptcy in this country, especially because of medical costs. Another violation of healthcare freedom that insurance companies have been doing that are now taken care of is dropping coverage after a person gets sick. So you've been doing everything right, you've been paying your premiums, and then you get sick and your insurance company drops you. I mean, many of us have heard these horror stories, and right now, why do you even have insurance if it's not going to be there when you need it and you've been doing everything right? So right now, your insurance company cannot do that to you anymore. They cannot drop you after you get sick when you've been doing everything right. And lastly, one of the issues to bring up is the excessive insurance industry profits and overhead are now capped, meaning that insurance companies must spend 80 to 85% of premium dollars coming in, your money, on actual health care, not on profits or overhead, fancy offices, CEO compensation, paperwork, etc. Actual health care, which is not that radical of an idea. Actually using your money on actual health care. And if your insurance company doesn't, now many do, but if your insurance company does not do this, they have to send you a rebate by the end of the year. And in Wisconsin alone, there was over $10 million in insurance rebates coming back to Wisconsin consumers by companies that overcharge them. And this is going to take place every year. So making sure that our money in healthcare is actually going to healthcare and not padding the pockets of an insurance company. These are the protections that are in place right now. Ending violations to healthcare freedom, giving you more protections, and more positive benefits in your healthcare program. And so that's the end of this particular video of what's in place right now. My next one will be about what's down the line starting very, very soon. But please like this video, share it with others, comment below questions and all that you have, so we can make more videos explaining what's in the healthcare law and how to talk about it and make sure everyone understands. So thank you very much.